Good morning, everyone. Scott Maybor here with your Medicare Missive from the pond for Thursday. I think it's the 6th. Hope you're all doing well. So I was going to do my door number 3 today, but instead, I was on the phone last night with a client until 10 o'clock at night. Phone call started about 8:45, trying to fix the problem she created. And I think it's a good example because it has to do with drug plan deductibles. So her husband's a longtime client. She just turned 65. She went on to Medicare for November 1st. I explained to her that because a couple of her drugs are very expensive, she would be better off with a drug plan for November and December that has no deductible. The Medicare drug plan deductibles, which this year is $590, next year is $610, they're annual, so they reset in January. So what I said to her is, since you have 2 or 3 drugs that are going to hit the deductible, the $590, you would be better off having a plan that does not have a deductible. Now, the drug plans that don't have deductibles are typically much more expensive. So the drug plan I recommended for her and enrolled her in was about $150 a month. So a very expensive drug plan. However, it saves her $600 of copays, or paying off the deductible. So the medication that she needs, I think it was Trelegy, but don't quote, I'm not positive, on a plan that has no deductible, which is what she begged Medicare to move her to because she was very confused, but has a $590 deductible and an $18 a month premium. She will now pay that first month about $375 to fill that medication. If she had stuck with the original plan that I put her on, she would pay $47, admittedly more in premium, but $47 plus $155 times 2 is still less than the $590 plus $18 plus the taxes, $590 deductible plus the copay plus the premium that she's going to pay now. And I don't think I can fix it again. I mean, it's when you're buying a plan for just November, which is already passed, or December, keep in mind that the deductible has to be paid prior to your drug coverage starting, even if you only have it for a month or 2, as in her case. So if you are going for a December 1st start date, you may want a plan that starts in 2026, but then take an expensive plan for the 1 month, just so that you don't have to pay that deductible in the month of December. The other way to do it is to see if you could get like a 90-day fill before you switch plans. So she's created a huge problem for herself. It's going to cost her hundreds of dollars because I don't know exactly who she spoke to, but I know she spoke to 2 carriers for hours and Medicare, and filed complaints against the carriers who did nothing wrong, all because rather than one, and we discussed this, and I put it in an email, and rather than wait to talk to me, she just decided she's going to call all these people and reverse what was done intentionally to save her money, and now she's wasted 2 days on the phone, and she's going to spend all this money. Be careful. Watch those drug deductibles, and if there's a way around it, then do it. Let me know if you need any help or you have any questions. Thanks for watching. Have a great day. Stay safe.